Welcome back to another incredible episode of Mind, Your Body, and Soul. I believe now we're in season 4 now. Yeah, because we recorded a lot of episodes over the last 2 years, and we're in season 4 now. Now, forgive me for not knowing the exact episode number. It be like that sometimes. We be busy in the community, be like that sometimes. But we are in season 4, and we like to thank everybody who has supported us from day one and who are still supporting us, and all of our new supporters. So make sure you subscribe to this Neighborhood Medical Center YouTube channel. Make sure you do that, and make sure you check out all of our Neighborhood Medical Center podcast platforms. Let me get into all that, but. This is a new episode of Mind, Your Body, and Soul. And Mind, Your Body, and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. So you can catch us once a week on our podcast at www.nmcpodcast.com. We also have our parent website, which is www.neighborhoodmedicalcenter.org, www.neighborhoodmedicalcenter.org. We're also available on Anchor Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and once again, this YouTube channel. So make sure you like the video, comment, subscribe, and share this video. That way more people can see it. So today on our podcast, we have a young lady. So I met her at a community event. Now I'm a bit familiar with Healthy Start, but not fully familiar with Healthy Start and all of the services that Healthy Start has to provide. So I met this young lady at a community event at one of my favorite community centers, the Jacksonville Community Center. So we got to talking. She was telling me about what she does for Healthy Start. Ran into her again at another community event at the Carter Howard Strong Park. We had a longer conversation about we talked about some of everything. But I wanted to make sure we get on the podcast because she works works for Healthy Start, does community outreach, but also is the program coordinator for the fetal infant mortality rate program that they have. And infant mortality rate is something that does affect our community and the people that we serve. So we want to make sure we get her on here and talk about infant mortality rate, but also in totality what she does in the community and Healthy Start as well. So her name is Jasmine Thornton. She is from Jacksonville, Florida. So shout out to Duval County. She is a graduate of Florida State University, where she earned a degree in family and child sciences. She has experience working in child welfare, college ministry, and leading the women's ministry at her church. So she has spent a lot of time in the community, serving the community and giving back. And we're gonna learn more about her. So Ms. Jasmine Thornton, welcome to Mind Your Body and Soul. How you doing?
Thank you. I'm doing great. I'm glad to see a new week.
I
It was
know,
a long
right?
weekend.
I know, right?
Yeah.
And we got the man back in the podcast. He been so busy. He's been taking care of people on the left and people on the right and front and back. So Matthias Sweet back on the podcast. What's going on? How you doing, Matthias?
Nothing much. Taking a break. Fine. I'm happy to be back. I saw it pop up on count. I said, yes, I can make it in today.
I know. Let me send you these questions.
Yes.
Yeah, I'm sending you these questions so we can get into it. But in the meantime, Matthias, this is Jasmine. Jasmine, this is Matthias.
Hey, Miss Jasmine, how you doing?
So, Jasmine, can you give our audience some background information about yourself and why is it important for parents to have access to pre and postnatal care?
Yeah, so like you said, I'm from Jacksonville, born and raised. And if you know anything about Jacksonville, it's actually like the largest city in Florida or something, like land area wise. And it's a lot bigger than Tallahassee.
Yes.
But it still kind of has, like, I feel like it still kind of has a small town feel because like everybody knows everybody.
Right.
So that's where I come from. And I also come from a very large family. So family is just like a big part of my life and upbringing and what I value. So that kind of shaped different things I was involved in and passionate about as a child. Like you mentioned, community service. That's something I started doing in Jacksonville as a child, serving with like the Down Syndrome Association, Daniel Club. There's a place there that's kind of like a group foster home situation. So different things like that, even serving in orphanages in the past. So that's something I've always had a passion for. And yeah, when I came to FSU, I came to FSU because I wanted to get away from Jacksonville. But it was like close enough to Jacksonville that I can still see my family and everything. But yeah, my degree field definitely embodies the whole community and social aspect of the child in the context of the family, and then the family in the context of the environment around it. So yeah, and I've been working with Capital Area Healthy Start for the past year and a half. So I'm still kind of new and learning every day. Before that, I was working with DCF for about 3 years. So I got to see a lot of different situations, but Capital Area Healthy Start is focused specifically on maternal and child health. So I'm a little new to the maternal part, but like I said, I'm learning. And as far as having access to pre and postnatal care, it's very important in order to have the best pregnancy that you can have, and also taking care of yourself and the baby. Because the baby is basically extension of the mom's health. So it's good to have the prenatal care early on and stick with that all the way through the prenatal care into the postpartum period, so that the mom can heal and the doctor can show, or the midwife can show what's going on with the baby on the inside. People may not know things. And also it helps you with your chances of having a baby again, because the preconception health is important, but also the interconception health in between babies is also important.
So it's safe to say you have a passion for helping children.
Yes.
How did that develop?
I know this might be funny, but I would say I'm the resident babysitter for all of my family members. So it probably had a lot to do with that. Like I said, I probably have about 200 cousins. So whoever was, whoever was younger than me, a good age, or even when I was still a child, I was babysitting other babies. So it probably came from that. And then just learning in school about different topics in the healthcare field as well. I think that kind of shaped me as well.
Okay.
That's cool.
So for the people who really don't know what type of organization Healthy Start is, can you just tell us what type of services that y'all provide and what you do for the community?
Yes. So our grand organization is called Capital Area Healthy Start Coalition. And so we're a community coalition of a bunch of different agencies and partners that are working to improve the health of moms and babies. And then Healthy Start is one of our direct services programs that's like a home visiting program, and that's in essence, that's what it is. And then we also have another one that we promote called Healthy Families. That's kind of similar. And then we also have Sister Friends, which is another program, which is like a mentorship program. So it's like a large umbrella and a lot of different branches. And then in order to even get into any type of program, you go through our Connect program, which is those specialists, they would just talk to you and do like an assessment of your needs and like kind of where you're at. And then they can connect you to whatever resources you might need. So for example, we offer help with stress management, financial literacy, childbirth education, parenting, helping point you to basically getting ready to have a baby, like making sure you have your insurance in order, making sure you know about WIC and pregnancy Medicaid, helping you with parenting. Something in the past that we've done is hosting infant CPR classes, so you would know safety measures of how to deal with a situation like that should that arise. So it's a lot of different things. I don't know if you have any more specific questions, but
Yes, I do. So like, how would they get to the intake person? Like, what is the whole process of like, and who qualifies for these programs? Because a lot of people feel like, oh, these programs are out here, but I don't qualify.
right. So anyone, the services are all voluntary and they're open to anyone. They are aimed at specific at risk. There's specific risk factors that we've identified through evidence and research that could impact your pregnancy in a negative way. And so we have those identified. So there's 3 ways to get into the program. Is you can self-refer. If you just happen to know about Healthy Start, someone has told you, you can always contact us. That's a self-refer. Right. You can be referred through your prenatal care provider. And that's one of the main ways that people are referred, because the prenatal care providers are the only ones who can fill out the prenatal risk screen, which is the assessment that was formed by the health department. And it assesses those risk factors that I was referring to. And then the third way is through a community referral, which is any other agency that is familiar with Healthy Start. And if they, maybe you're at WIC or you're at the hospital or a clinic, wherever you may be, and if they know of Healthy Start and they feel like you can benefit from our services, they can directly contact us as well. And if you wanted to know what some of the risk factors are,
yes.
So it could be, let's say you had a previous poor outcome as far as you had a loss before, or you had a premature baby before, you had a baby with a low birth weight. Your race can be a risk factor as well. And it's not because your race is a bad thing, but just because of systemic issues of how you may be treated or certain things you're maybe predisposed to. If you have no support system, that could be a risk. If you have substance abuse issues, you had a medical issue, mental illness, anything like that, those could be risk factors.
Right. So now, and I appreciate how you are answering this question and the information you're giving, because I didn't understand the concept of the umbrella and then the different services under the umbrella for a Healthy Start. Because because this is how we say it, we just call it Healthy Start. So for us, it's all one thing, but you're breaking it down. We have different components of it, and all these different components can serve different facets of the community to be able to help people in various situations, because everybody's not going to be in the same exact point at the same time coming to you guys. Okay. So if I'm a parent and I'm just learning about Healthy Start, somebody told me about Healthy Start and I'm excited, okay, I can get services. What tips or recommendations would you give new parents or new parents, or even people who are already parents who are just finding out about Healthy Start? What information would you give them to help them better take advantage of the services that Healthy Start has to offer?
Yeah, so like I said already, I think all the services are voluntary and confidential. So we can only provide what you will allow us to, and that those services are, specific to you and are, sacred in the sense is that it's not going in the streets or to all these other people. So the care coordinators or the intake specialists or whoever's you're working with is going to be helping you specifically for your needs. And in order for them to know your needs, you got to speak and be honest and tell what those needs are and be open to that contact, because the home visiting services are in person. So You're going to be meeting either in your home or in some neutral place or something like that. So you have to be open to that type of contact, because some people they don't want people in their home, or,
True.
they're really guarded about certain things. So I think that's the key thing. And yeah, also just kind of seeing us in a positive light, that we're here to help, and there's nothing to be ashamed of. Nothing to be ashamed of as far as even asking for help if you need it. And also that there's always something that you can learn and grow in. Like, no one has it all figured out.
Right.
And we're also not judging you, if you believe a certain thing or do a certain thing. We're just here to offer extra support.
True. That's good, because
Well, that goes into my next question, because it always, you know what I'm saying, when you're expecting, it's always a different. What do I need to do? What's how? All that. So what would Healthy Start tell a person who is expecting about the pregnancy, about the birthing process, to ensure that they have a healthy baby?
Yeah, so this is more so so the intake specialist, this is kind of their wheelhouse, as well as the care coordinators. So like I said, every referral starts off with the Connect program, so the intake specialist, and then they do a small assessment, and once they decide what they need, they would refer them to the appropriate program that would help them, and then they'd have a different care coordinator to connect with them and do the actual home visiting part. So you said what your question was, what would they tell them?
Yeah, about like the pregnancy and like the birthing process, to make sure that they help, because that's kind of, there are different ways to go with the birthing process, and what's best for the baby. It all depends on the person, and saying what's going on with that person, the health issues, everything. So what's some of the advice that you could give the people to ensure that they have healthy babies?
So this is something that's later in the pregnancy, but this is something we promote a lot, is kit count education. So once you're in your third trimester, 28 weeks and later, you want to be tracking your fetal movement. And we actually have, well, we didn't create it, but there's an app called Count the Kicks that you can use to track your fetal movement, and it actually makes like a graph for you, and you can chart it and everything, and you can show it to your prenatal provider if you have concerns about your baby's fetal movement. And that's a way to kind of alarm you if there is something going on with the baby, because there's a certain amount of kicks that the baby should have in a certain span of time at a certain age of development. And so if you notice a change in that, then that's a sign that something may be wrong with the baby. So then you can go seek medical care, and then, you can address whatever may be wrong. So that's one of the things, is tracking fetal movement. Also knowing about the signs of preterm labor. That's something that one of the coordinators would talk to a client about. You also having like a birth plan, that's something they can help them come up with. They also come up with a plan in general when they do each appointment, or when they start off, do the initial intake, and then when they do each appointment, they come up with like a plan to help them, like, okay, what are the things that you want to achieve, and how can I help you achieve that, and what are the specific action steps that we need to take to achieve that. And so they come up with that at like the first appointment. And so all the other appointments are kind of addressing those things and following up on those things, and then, seeing if they need to change the plan or update it.
Oh, that goes into another thing there. It's like about outreach. So you're saying your position does outreach specialist as well. So how do you use outreach and interact with potential clients and new clients and previous clients, especially with education? So how do you use your outreach to interact with the type of patient?
Okay, so I'm not one of the direct services people. My role is kind of more behind the scenes, but I do outreach surrounding prenatal care and postpartum care, and just whatever initiatives that we're working on as an organization. So every week I go visit all of the prenatal care providers in Leon. And that covers Wakulla County as well, because most people come from Wakulla to Leon to get their prenatal care. So I visit all of them every week. I pick up those prenatal risk screens that I mentioned earlier, and I turn those into the health department so that they can be processed. And then they, the ones that are being referred, they're going to come to us electronically. And then I also do trainings with the prenatal providers, helping them with the risk screens and any other topics they may need to know about. And one of the initiatives that I'm a part of working on is the Safe Sleep Initiative. So I'm going into the offices helping teach people about that as well. So we have a mini crib that I basically offer to all of the prenatal providers and any other agencies that might be interested in having one, just so people can see what it looks like for what the recommended safe sleep practices are, which is an easy thing to remember, which is ABC, alone on the back and in a crib, basically with no other toys, no other blankets, no other people, and in an actual child, a bassinet or crib, so that you can prevent any type of suffocation or asphyxiation or anything like that.
Okay.
Yes.
So it's so many people who don't care about none of that. It's so many people who don't care about none of that. And so what do you tell, like, especially the mother who is like, I want to sleep in the bed with my baby. I want to use this to bond. I want to do this and do that. Like, how do you combat her feelings about that using like factual information to say, hey, this will actually help you and your baby be safe?
Mm-hmm. So we do promote breastfeeding and skin-to-skin contact and bonding with your baby. That's all great. But you have to keep them in, there's limits and parameters to it. So we recommend not, okay, so there's all these terms. I'm gonna make up a word because
Go ahead.
The way it's written is not right. Co-rooming, so sharing a room with your baby. Like if you had a really small baby that's in a bassinet, it's great to have your baby in the bassinet right next to your bed. Right. But having the baby in the bed with you is not safe. And not even for naps and things like that, because it takes 1 second for something to go wrong. So yeah, if you want to still be able to watch your baby, just be in the same room with the baby, very close to the baby, but not in the same bed, because babies aren't equipped to sleep in adult beds. Like the way that they're made, the babies can't, they don't have some of them don't have the ability to turn, but then they also don't have the ability to breathe properly if something is obstructing their airway. Right. So yeah, it's very hard. Like it saddens me when I have to look at the specific cases of how these deaths occur. And like I said, it can happen in a split second. And sometimes the parents, they fall asleep while holding the child, and that's easy to happen. But if you can catch yourself, get up and put the baby in the crib if you can. And then even sometimes babies, they turn themselves when they get into any type of sleeping environment. So it's okay if the baby turns themselves, but you want to make sure that you put them on their back.
Right. But and another thing is, just going off of experience and what I've known, what I've seen, a parent is sleeping with the child in the bed from day one. Okay, the child is 5 now, and they're still sleeping with the child. Mm-hmm. But you got a whole husband, or you got all these things. So have you seen like attachment and like issues with socialization, dealing with that, with the parents just, I have to have my child in my bed?
Yeah, that does affect the attachment and like the child's ability to develop, because it's kind of like potty training. Like if if you don't ever teach the child how to go on their own, then they're going to be dependent on that diaper or pull up or whatever forever. And, you know, they're not developing in the right time frame.
Right.
So yeah, sleeping. Yeah, I'm not a parent, but I know a lot of parents, and they have their kids sleeping with them until they're 3 or older, and then it's harder to train the child once they're like a full-blown child.
Yeah.
Because they have their own attitudes and ways and things too. So yeah, it's better to do it when they're younger and train them at a younger age so that they can get used to sleeping in their own environment. And breastfeeding also is something that we recommend because it helps with the baby being able to, like I said, like breathe. And we also like it's a safe thing to have a baby sleep with the pacifier as well, because that's something that's also helping them with that sucking motion. So that helps them be able to breathe. And if something is obstructed, well, if the pacifier is there, nothing would obstruct their pathway as well. So.
Yes.
So, okay, so I know a lot of people, saying we get a lot of people don't understand terms, and you put these terms out there like infant mortality. Can you explain basically what infant mortality is and how big of an issue is it and who is mostly affected?
So infant mortality is when a baby dies that is at least takes one breath from the womb, one breath or in up until their first birthday. So any baby dying from 12 months to 0 age. And then the fetal, because I deal with the fetal deaths as well. So the fetal mortality is a baby dying at 20 weeks gestation or more. So anytime between the 20 and 40 weeks. And so that's considered a stillbirth. And your question was, who is it affecting? Well, it affects everybody. It's a community issue. It affects everybody. And as far as so we have a whole report that I have to do where we break down all these stats and things. So Black women are the most affected by it, as far as meaning that they're losing more babies than any other racial group. But it's affecting everybody. And according to the CDC, basically like the infant mortality rate of a community is kind of an indicator of the whole community's health in general. So let me look at my notes. So let me give you some stats. So in the last, like from 2018 to 2020, the infant mortality rate for the state of Florida has been consistent with 6% of deaths happening per 1,000 live births. And then in our area in Leon, in 2018, it was about 8%, and in 2019 it was about 8%, but it went up in 2020 to 10%. And the rate in Wakulla it's a little bit lower than in Leon, and also because they have a smaller population. But yeah, Leon's rate is rising. And I just also want to reiterate that basically, it doesn't have a respecter of person. Like anybody could lose a child, and your education wouldn't stop you from losing a child, or your social economic status. There's just like those risk factors that we mentioned earlier. Those are some things that can contribute. But it really could happen to anyone. But another thing that does contribute is prematurity, because most of the babies that we lost in our area in 2020, it was a premature birth, and that was like one of the main contributing factors as far as the cause of death. And then again, we've mentioned the safe sleep. last 2020, we had 7 sleep-related deaths in Leon and Wakulla, and then in 2021 we had 2. And then the other thing that's kind of a huge contributing factor is obesity. That in our area, Leon and Wakulla, 50% of the moms that had losses were obese before pregnancy. So that goes and ties back into like how your preconception health plays a huge role in the health, during the pregnancy and afterwards.
Right. That's a
So I
lot.
just got like a question. So like with COVID, were there more incline because everybody was home, everything was shut down. So people were eating differently, people were having things. So was that part of an increase with what was going on? Because I know you couldn't get to the people, things like people were getting
Right.
education, like that. And so were there more like deaths due to COVID because they weren't getting the information, they couldn't get the stuff. You couldn't get to the hospital. You could only bring one person. All those different things. So COVID a big factor for you guys on trying to provide education and stuff to people?
Yeah, it's interesting. So that's something that we had to include in the report that came out in 2020. The 2021 report is about to be worked on soon. So I'll start working on that soon. So we kind of working in the previous year. So in 2020, we did have some mom, like in some of the cases that we saw, the moms contracted COVID-19 during pregnancy, but I can only think of maybe one that where the baby died as a result of the COVID from the mom. But in 2021, we have about 3 or 4 that were fetal deaths. And the mom contracted COVID-19 during pregnancy and it caused the baby to die. And basically what research is saying about that is that the COVID-19 is affecting the placenta. And so when there's issues with the placenta, the baby cannot survive because the environment is not safe for the baby in the womb. So that's what's happening. We haven't really had as many like actual infants contracting COVID-19 and dying. It's been more so when the mom has it in the prenatal stage. That's what I've been seeing more of. And I had a meeting with some of the national people as well, and that's what they're seeing nationally as well. So I would say it has definitely affected the care that people are receiving. And we had to do telehealth for a while. But it probably could have affected like how soon people were able to get prenatal care and maybe how consistent they were able to be with their prenatal care. Because we do find that moms sometimes have issue with like transportation or childcare as far as being able to attend their prenatal appointments. So maybe it could have affected something like that, but that's still something that we're tracking and learning about. And in the database that I use to input all of the cases that we review, they have like a whole section that asks all these specific questions about how COVID-19 has impacted maternal and child health. And so the National Center is like keeping track of all that information and trying to, put it together.
Right. Yeah. Because we're in the HIV/AIDS field and we know how COVID affected us. We know how COVID affected as far as people's sexual activity. We got people locked down. People were having more sex. We know a number of, I'm not going to say more, but we know a number of children were made during, especially 2020. A lot of things happened. But I'm almost sure that the majority of the population wasn't thinking about a lot of the information that you were talking about as far as the safety and the wellness of the child, but also the child within the womb of the mother. And so I guess a question, I know you're doing outreach, Healthy Start has everything, but what do you feel? How do you feel that your information is? Do you feel like your information is being received by the populations that you are giving information to, and if they're receiving it, what in your not a guesstimation, what percentage of that would you say is actually using the information? Just a guesstimation, just actually using it.
I'm not sure I can fully answer that question because, like I said, I don't work directly with the moms. Right. So I might have to get back to you on that one and have one of my coworkers answer that question for you fully. Right. But I would say of the people who know of our services, that we do get pretty good reception. Just like, for example, when you and I were at the Frenchtown Renaissance a few weeks back, just some of the moms that I met there, that I met a few that were like currently in our program, or they had been in Healthy Start in the past, and they had their like kids with them that were like 9 or 10 or older, and they were just thanking us for helping them with their pregnancy way back when, and just saying, oh, we really appreciate what you all do and all of that. So that gives me just a glimpse into like how we've kind of been a staple in the community for a good while, and people are still, they still like our services, and then they would still refer our services to someone else who might be in need. So yeah, I can't really give you numbers. I would say do get pretty good reception, but there are still a lot of people that do not know about what we do, or have like a misconception about what we do. So yeah.
I know we're constantly telling people about Healthy Start when we do our presentations, especially on college campuses, and we're talking about unprotected sex, but we're just giving people options. Hey, there is Healthy Start available. So so we do our best to try to tell people about you guys.
Right. And that's something that we are working on too, is like not just reaching the moms, but reaching the other people who would be connected to the moms, such as like the grandparents, because the grandparents are often watching the children too, or any type of other guardian, or even the children, or like you said, teenagers, people that may become parents in the future. We want to inform them about our services too. And also trying to get the fathers. So we mostly work with the moms.
That's what I was about to ask.
Yeah, we mostly work with the moms, but in certain situations, like unfortunately, sometimes the mom dies at birth, and you might have a single dad. So we can also help single dads or dads just that are involved as well. So we're trying to come up with programs and things that are more targeted towards the fathers too, and including them in the picture because they are important.
So are there, to your knowledge, are there any services for single fathers in this area? Just like period? Because I know you guys offer some things, but if I'm a single father, where and from your knowledge, where would those single fathers go for resources and services?
Yeah.
We got to work.
Yeah. That's another one. That's another one that I would have to ask someone else to give me, because I asked my coworker or my boss about that recently. I was asking her like, okay, if it was a single father, like what would he do? But yes, the single father could still be referred to us. I guess they would have to probably go through a community, or maybe the hospital or something like that would be able to refer them to us. Yeah, I'm not sure, because we have lots of pregnancy testing centers. We have the Pregnancy Health Information Center. And then, we have places like you all, Neighborhood and Bond, and all these different prenatal providers and clinics and everything. But I'm not sure. I'm really not sure about that. I'm sure there are things that exist, but I don't know of all of them. I know there's some in other areas. And that's why we're trying to adopt programs from other areas, and people that do that well, because there's Healthy Start all throughout Florida and throughout the U.S. So down in South Florida, they have they have a lot more stuff for fathers. But
Yeah, I didn't know the answer to that. I was just shooting in the wind. Hoping.
yeah. Yeah, I'm not sure. I mean, I know 211 is a resource that can kind of connect you with all types of things. But yeah, I'm not sure.
Right. So you studied child sciences is what you studied. So how did that help prepare you or even help give you any type of information for doing the position that you're doing now, working with infant mortality rate, just working with Healthy Start, period? Because you love children. So, but I think that's so cool that you took this passion and you're making a profession out of it. But how did your major help contribute to what you do now and helping you help others?
Yes. So my degree is like one part child development. So learning about the child and from like conception to childhood, like every stage of what happens in the womb and then what happens once the child is born and like all the developmental milestones that would occur. And then kind of also family dynamics, how the individual forms their personality, their temperament, all of that type of stuff. And then how crises in the environment and different things on the outside influence that person and their behavior and how they respond to the world around them. So that's kind of in a nutshell what the degree goes into about. And so that just kind of helps me to get some insight into what the clients are going through that we service, and also just seeing how the whole family plays a role in the health of the mom and the baby. Because sometimes like the deaths that I encounter, sometimes it's not the mom who has done something to harm the baby. It could be someone else who's watching the child. So you want to make sure the whole household is on the same page. And yeah, just seeing how all these systems interact and learning about like stress and how that impacts the family unit. And stress is a big thing that can impact the maternal health and the health of the baby. Also learning about like mental health and how that impacts the whole family unit. And then, like I was saying earlier, just seeing that infant mortality is a whole community effort. And so it takes all of us. In my meetings that I hold with the community, I hold meetings every month and also quarterly with our different community partners. And so some of the people that we're working with is law enforcement, child protective services, legislators, insurance providers, anybody in social services, anybody in healthcare. So it takes everybody doing their role and helping everyone to be informed and making sure that people can have the best pregnancy outcome.
Right. Yeah, because that's one thing we want to ensure is an increase of healthy pregnancies and healthy births, especially in our community. But even from this side, the HIV side, because we got to a point where we greatly reduced the number of children born specifically with HIV. But you know, the two main was HIV and syphilis. We reduced those numbers. Of course, you had a small uptick during COVID, but the numbers were greatly reduced. So we're just looking across the board. And that's why, for me, it's good to have these interviews and being able to sit down and have these conversations, because we're kind of seeing how we're helping each other directly and indirectly. So, you know, we're out here saying, hey, protect yourself, have healthy relationships, and hopefully that translates to actual healthy relationships being cultivated, and which would lead to healthy children being birthed and raised. So we got y'all back. We down. Y'all got our back. We got y'all back. So we appreciate it. So When a woman finds out she's pregnant, from that time she finds out she's pregnant, just kind of a rundown. So I'm asking this as a man, and I'm asking this for all those who may not know. So if a woman finds out she's pregnant, what should she do for herself and her baby to make sure that she has the healthiest pregnancy, the healthiest birth? She's in the best position for herself and the baby to survive and be as healthy as possible. Like what are some of the steps that woman or even the couple should take?
Yeah, we've kind of talked about some of this already, but prenatal care, getting into prenatal care in your first trimester is great because there's certain screenings and different things that they're gonna do from the get-go, and that can help you know like what state your body is in and what state the baby is in, because the baby starts developing very young, very early on. So the prenatal provider can see all of that and get your ultrasound done and all of that. And then they'll order lab work if they need lab work, and they'll refer you to other specialists if they can already tell that you might be high risk. They may have another specialist follow you. So the earlier you get into prenatal care, the better. Like I said earlier, your preconception health is important. So I know your question is once they find out they're pregnant, but if you we do promote family planning as well. So if you are wanting to get pregnant and you're wanting to have children, you can start taking care of yourself ahead of time. Taking the prenatal vitamins and monitoring your diet and your exercise. Getting a lot of sleep is good. Like I said earlier, getting all of your insurance and Medicaid or WIC, getting those things in order ahead of time. You mentioned about the risk factors earlier. So knowing your own risk factors, things that might impact your pregnancy, and, talking to your prenatal provider about that. Managing stress well. And the big thing is advocating for yourself during the whole process. And that can be with the prenatal provider, with whoever you're talking to or whoever is helping you through the pregnancy. You want to ask questions. You want to express your concerns when you have concerns. Also, like I was saying earlier, if you feel like something is wrong, don't delay in getting medical attention. If you feel like something's wrong and you need medical attention, because that's something that happens a lot. It's like, you might feel something's wrong, but you don't respond right away. And then you wait 2 days and then it all goes wrong. Sometimes it's preventable if you respond quick enough. So again, all of all the things we've been saying throughout the whole time.
Matthias, remember, I think it was a couple of years ago. Well, of course, pre-COVID, but we were somewhere and some of the young ladies found out about the prenatal pills. And it was funny because the idea of the prenatal pills, they just was like, they was looking at the prenatal pills like men would look at Viagra. And it was like, I never seen people get so excited about prenatal pills and things. And I'm like, so I was happy you mentioned the prenatal pills, and you made me think about that and laugh for a minute because I remember having that.
Yeah, those just get your body prepared for all the changes that it's gonna go through.
Yeah.
Yeah.
That's what's up. Yeah. So look here, people. One of the main things she mentioned was planning. Planning. Now, of course, we understand every situation is not going to be like that, but for the most part, do your best for both parties to plan things that's happening, because that helps to increase the probability of health and a more successful pregnancy and a more healthy and successful birth and all those things there. So planning, making sure you're going to the doctor. Everything she mentioned, going to the doctor, get checked out, knowing your family history, knowing her family history, knowing medical history, all those things that matters. If, especially like for one thing for our community, sickle cell, that really greatly affects members of our community. If you are a carrier of sickle cell, it's the person that you may be planning on making a baby with. Are they a carrier? I think I was looking at something that said 2 carriers, it's at least a 25% chance of sickle cell trait developing in the child. So just knowing all the history, having conversations about family before we get, before a child is made, instead of waiting after the child is made. So just making sure that true planning is happening. We're sitting down and we're doing what we need to do to ensure the better health of the child. So.
Can I add something?
Yes.
Just what you were saying. So, and yeah, not just the mom's health is important, but the father's health is important as well. His preconception health, because the man's health can affect the baby as well, and a lot of people don't talk about that or even know about that. And I want to say we have lunch and learns every month. And right now we're focusing on preconception health. So we just had one on men's sexual health, I believe, and referring to like reproduction. That was last Friday that just left. So if you want to watch any of our other recordings of those topics, they're on our website, which is capitalareahealthystart.org. And that's another way that we strive to educate the community, kind of like a informal format where you get to see an expert do a presentation on a certain topic that you may or may not know about, and can be informed that way, and you can share it with other people.
So I'm on the website. I see an advertisement for community doula training that they have. Just real quick, what role does a doula or midwife play in helping to make sure the child is healthy during pregnancy and during the birth?
So there are doulas that help in the prenatal period, and then there's also doulas that help in the postpartum period. So depending on which one, you can have both if you want, or you could have one or the other.
What's the difference between the doula and the midwife?
The doulas don't have like the training to actually deliver the baby. They're kind of another source of support like us, but they're a little more intimate and up close and personal. So they'll actually go with you to if you allow them, they can go with you to your appointments. They can be with you in the delivery room. They can coach you through every stage of the pregnancy or after the pregnancy. Specifically the postpartum ones, they actually come in your home and they can help you with like housekeeping or watching the child for a moment, or just anything that you need, again, to be an extra source of support. The midwives, they also are prenatal providers. There's some of them who actually can deliver babies, or some of them just help you through the prenatal care part, but then they would have someone else deliver the baby. So it depends on their certification, their education and training. But yeah, doulas are kind of less formal, I guess. I don't know how to say it.
Gotcha. Well, we are a lot more educated on Healthy Start, because I did learn some things about Healthy Start that I did not know. We're a lot more educated on infant mortality rate, on what you do, and just overall what we can do as human beings who are or part of families and who will be starting families soon. The best things that we can do to keep our families safe: prenatal care, postnatal care, preconception care, all those things from the male side and the female side, making sure both parties are coming in, planning to have a successful birth, successful pregnancy, successful family that's being raised. So you're awesome, Jasmine. We appreciate you.
Thank you.
So We know. So you mentioned you all's website, capitalareahealthystart.org.
Yeah.
Mm-hmm.
Is that the best way to get in contact with you? Say somebody see this interview and they want to get in contact with you. What's the best way for them to contact you?
So they can contact me by email or phone. Most people email me. I don't get a lot of calls, but so it's Jasmine, JASMINE at capitalareahealthystart.org. And then if you want to call, our general phone number is 850-488-0288. And my specific extension is 102. And then we're also on all the social media things. We're on Facebook, YouTube, Instagram, and Twitter, and that's all at Capital Area Healthy Start Coalition.
We have to subscribe to y'all's YouTube channel.
Yeah. Yes, we have like our different events on there and different presentations and things.
Okay. And for all of our viewers, all the information that she just mentioned for her contact information and Healthy Start contact information is in the description of this video. So scroll down and look in the description so you can see that. And go access the information and use the information that was just given, because that's how we grow and get better as a community. And so this is how we do it. So I look forward to seeing you in the future in the community. I know we're going to run into each other, so we're going to stay in contact.
Mm-hmm.
And Matthias, we appreciate you joining us, my brother. You free-ish.
Appreciate you for having me.
You free-ish. They're trying to keep you down. We're going to stop it, though. We're going to fight back. So all of our viewers.
Fight back real hard, Joe, real hard.
You got to. All of our viewers, once again, we thank you for riding with us. This is season 4. I forgot what episode number this is. You'll see when we do everything. But this episode, season 4, episode, whatever you want to make it. And I am Joseph Ward. He's Matthias Sweet. She is Jasmine Thornton. The reason why we're here, and remember that Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. Remember our website, www.nmcpodcast.com, as well as our parent website, www.neighborhoodmedicalcenter.org. We're available on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and of course this YouTube channel. So subscribe. With that being said, we will see you guys next time.